Well, we've been talking about it, and maybe you've been noticing it, that plume of Saharan dust drifting across the region there. A lot of you are noticing the changes in air quality and an increase in some symptoms from it. That dust, which travels, by the way, thousands of miles from North Africa, can have a very real impact on you, your eyes, your nose, your throat, overall just your respiratory health. So joining us this afternoon is Dr. Matthew Tyler, an ear, nose, and throat doctor with Baylor Scott and White. Thank you so much for joining us.
Thanks for having me.
Of course, let's talk about the symptoms that you're typically seeing right now because of the dust in the air.
Well, usually patients will have symptoms from dust exposure that include nasal congestion, lots of mucus production, and sometimes a little bit of a mild cough. This is for maybe the average healthy patient, but sometimes patients who have other chronic illness like asthma, sinus inflammation, or even allergies may experience more severe symptoms.
Walk me through kind of how delicate the situation might be for people. So is it just a trace of dust in the air that can cause these problems, or does it have to be really bad out there?
Well, I think the air quality index has to be pretty bad. I think for most healthy individuals, a little bit of outdoors exposure and even prolonged exposure may not mean serious health consequences. But in those sensitive populations, older patients and those with chronic respiratory illness like asthma, COPD, and even sometimes allergies to some extent, they're going to be at higher risk. Small amounts is generally okay, but it's really that prolonged exposure where the health risk is more serious.
Gotcha. Explain how this risk on top of those things that maybe you already have, like allergy, asthma, sinus issues, on top of all that, this risk of the dust, how also that is important.
It's important because with prolonged exposure, someone with maybe chronic sinus disease like nasal polyps may get pushed over into a sinus infection or a sinus exacerbation that can last several weeks. And patients with asthma or poorly controlled asthma can also have exacerbations in their asthma disease where they're requiring more inhalers or maybe even an ER trip because they're getting more shortness of breath. And the same goes for people with COPD as well, maybe an ER trip because they're getting more mucus and more difficulty breathing. If that tends to happen, even after the dust exposure declines, then it's important to see your provider or healthcare professional.
Yeah, that's a good point. I think we'll touch on that in just a little bit. But with the Saharan dust, it is not new. We've heard about this before. But how does it differ from things like maybe we have also seen before, smoke in the air from wildfires, things like that?
Smoke, it's a great question. Dust in general is a higher, it's a larger particle, so most of that tends to get trapped in our upper airway, like our sinuses, which is the natural first line of defense for our lower airways. Smoke can be a little bit more tricky, in some ways more dangerous because the particle is much smaller size and it can go directly into our lower airways. So especially those patients with chronic lower airway disease like asthma, COPD, emphysema, they're at higher risk for this because those small particles directly bypass the sinuses and nose a lot of times and go straight to the lower airway.
Doctor, you talked about that connection there. Tell me a little bit more about how the Saharan dust does impact you to where maybe if it lasts days after that, that's the point you want to talk to a doctor, right?
Yes, I think if those symptoms persist for several days or maybe even weeks, or they start to cause symptoms like shortness of breath, or maybe the mucus production or volume or thickness is getting much more significant, then you're going to want to seek out the advice of probably a medical professional. At Baylor Scott and White, we have an app called My BSW Health where you can get set up with a professional same day and many times get same day advice.
Those same day schedules are crucial, I think, for a lot of people, especially around this time. Let's talk about treatment and then we'll talk about prevention. What do you do to treat this?
Well, I think in general, you're trying to limit exposure. So for most people, as I said, who are healthy, limiting exposure goes a long way. If you develop mild symptoms, then a little sinus saline irrigation or maybe a topical nasal steroid like fluticasone goes a long way. Allergy medications like antihistamines may not be as effective because this is not a pollen and you're not going to see a histamine response. So those may not be as effective. For patients who have chronic illness or chronic respiratory disease, you're going to want to make sure you're staying on your medications as you are every day. But I think in those patients in particular, you want to limit your exposure as much as possible. So this means limiting outdoor time, as hard as that sound nowadays when there's so much sun and nice warm weather to enjoy, but limiting exposure, closing the windows and just trying to not spend as much time outside.
Yeah, it's hard. As you mentioned, it is summertime. A lot of kiddos want to be able to go out and enjoy themselves, but you don't want them to come back with that cough or those irritants that you were talking about. So we appreciate your time, Dr. Taylor, so much. Thanks for helping us out.
Thanks for having me.